The next time you call 911, if you have to call 911, it might take a little longer for paramedics to get to the location. That's because they say that it's because of COVID-19. Hunter Davis joining us live from Dallas. And Hunter, I understand that COVID-19 has put such a financial burden on these paramedics and forcing them to just call it quits.
Yeah, that's exactly right. You basically have an increase in costs accompanied by a decrease in revenue. Now, it's because of that these people tell me it's just the perfect storm.
Ryan Snow has been a firefighter paramedic for more than a decade, but this year has been the hardest.
Just trying to work through being able to function on a high level, knowing that there's people suffering and everything going, the hell in the handbasket around you, and trying to be the best that you can be.
In addition to the mental and physical toll the virus is taking on paramedics, prices of certain PPE materials have more than quadrupled, hitting the emergency medical system hard.
We used an average of 6 N95 masks per day, and they cost us 67 cents. Today, we're using an average of maybe 200 per day, and they're costing us $3.50.
Invoices from MedStar in Fort Worth, Texas show before the pandemic, an order of masks was about $23. That price now more than $4,000, taking their total monthly payments for just masks from about $200 to more than $23,000.
One of the things that we've always been fearful of is, what if you call 911 and nobody comes? In some of these communities where EMS agencies are having to close because they don't have the personnel, they don't have the funding, they can't afford to operate anymore, that's beginning to happen.
The American Ambulance Association reports at least 6 services have closed, and it's trying to get more money to keep others open. In a letter to the Department of Health and Human Services asking for $2.6 billion in emergency funding, the association says the EMS across the country is at a, quote, breaking point.
At the end of the day, you have to protect yourself and other people and treat the virus with the respect that it deserves, whether you're affected by it or somebody else is affected by it.
Meanwhile, Governor Greg Abbott announcing all healthcare workers should receive their vaccine within the next 3 to 4 weeks, according to his COVID-19 vaccine distribution plans that will include paramedics. In Dallas, Hunter Davis, Fox 26 News.